Hi, my name's Amanda and I'm a pharmacist. This is my full video presentation series of the top 200 drugs. It includes 12 lectures combined into one video for your convenience. And as always, if you find this helpful, please like, share, and subscribe. Thanks, I really appreciate it. Hi, my name's Amanda and I'm a pharmacist. I'm doing a video series of the top 200 drugs. I'll be covering what the drugs are for, their generic and brand names. This is part 1, cardiovascular drugs. First, we'll look at the thiazide diuretics. These are known as water pills. They're for high blood pressure and swelling. You have chlorthalidone, and the brand name is Hygrotton or Thalatone. There's hydrochlorothiazide, its brand name is Microzide. And there's a combination product, hydrochlorothiazide triamterene, which is Maxide or Diazide. Next is the ACE inhibitors. They're also known as the angiotensin converting enzyme blockers. They're for high blood pressure and heart failure. They all have the suffix pril, P-R-I-L, at the end of the drug name. So there's benazepril, which is low tensin, ramipril, which is Altace, enalapril, which is Vasotec, lisinopril, which is Prenavil or Zestril, and lisinopril HCTZ, which is Prenazide or Zestoretic. Next is the ARBs. ARBs stands for angiotensin II receptor blockers. These are for high blood pressure and heart failure, and they have the suffix sartan, S-A-R-T-A-N. So you have losartan, which is Cozar, valsartan, which is Diovan, losartan HCTZ, which is Hyzar, valsartan HCTZ, which is Diovan HCT, and irbesartan, which is Avapro. Next is the beta blockers. These are for high blood pressure and irregular heartbeat. They end with the suffix OLOL, O-L-O-L. There's propranolol, which the brand name is Inderal, metoprolol, which is Lopressor, or Topril XL is the extended release version. There's carvedilol, which is Coreg, atenolol, which is Tenormin, and nebivolol, which is Bistolic. Next is the calcium channel blockers, and there are two types. First, we'll look at the dihydropyridine type. These are for high blood pressure. They end with the suffix ipine, I-P-I-N-E. First is nifedipine, which is Procardia or Adalat CC. Then amlodipine, which is Norvasc. And amlodipine benazepril, combination product, is Lotrel. Next is the non-dihydropyridine type of calcium channel blockers. And these are for high blood pressure and for rapid heart rate or abnormal heart rhythms. There's diltiazem, the brand name is Cardiazem, and verapamil, which is Kalin or Verilin. Next is the alpha blockers. These are for high blood pressure and also for enlarged prostate symptoms, or BPH. These end with the suffix osin, O-S-I-N. And you have doxazosin, which is Cardura, terazosin, which is Hytrin, and tamsulosin, which is Flomax. Now the tamsulosin, it is a selective alpha blocker for the urinary tract, so it is mainly for the symptoms of BPH, and it has less effect on the blood pressure. Next is the alpha-2 agonists. These are for high blood pressure and also for attention deficit hyperactivity disorder, ADHD. There's Clonidine, which is Catapress, and Guanfacine, which is Tenex or Intuniv. Next are the vasodilators. These are for high blood pressure and heart failure. And the specific nitrate vasodilators, they're also for chest pain. So there's Hydralazine, which is Apresyline, Nitroglycerin, which is Nitrostat, and Isosorbide mononitrate, which is Emdur. Then there are other diuretics, or water pills. There's the loop diuretics, which are for swelling from various diseases, and that includes furosemide, which is Lasix. Then there are the potassium-sparing diuretics, which are for high blood pressure and heart failure. And included in that is spironolactone, which is aldactone. Then to finish this out, there are a couple other cardiovascular drugs we'll review here. There's the antiarrhythmics, which are for irregular heartbeat. And this includes amiodarone, which the brand name is Pacerone or Cordarone. And then there's a cardiac glycoside in the top 200. It's for heart failure and irregular heartbeat. And it's digoxin. The brand name is Lanoxin. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Up next, we'll be continue looking at the top 200 drugs. We'll do part 2, the blood thinners, cholesterol, and diabetes medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. I'm continuing with my top 200 drug series. Today we'll be looking at part 2, blood thinners, cholesterol, and diabetes medications. We'll be covering what the drugs are for and their generic and brand names. First, we'll look at the anticoagulants. These are known as blood thinners. They're for the treatment of blood clots and the prevention of new clot formation. Now, these don't actually thin the blood. What they do is interrupt the body's natural clotting process to prevent heart attack and stroke. And there are some different mechanisms for doing this. First is the vitamin K antagonist anticoagulants. These block vitamin K, which is involved in the clotting process. An inconsistent dietary intake of vitamin K can interfere with their effectiveness, and they require INR blood testing to make sure that the blood clotting is kept at a safe and effective level. And we have in this class warfarin, which the brand name is Coumadin. Next, we have direct oral anticoagulants, or DUACs, and in the top 200 we have 2 direct factor 10A inhibitors that are under this class. Now, these are not affected by diet, and there is no INR blood testing required for their monitoring. These end with the suffix aban. So there's apixaban, which is Eliquis, and there's rivaroxaban, which is Xarelto. Next, we'll look at the antiplatelets, also known as platelet aggregation inhibitors. Now, these aren't technically anticoagulants because they don't affect the clotting process, but they work by preventing platelets from sticking together to decrease the risk of heart attack or stroke. With these, you have aspirin, the brand name's Ecotrin, and clopidogrel, which is Plavix. Now we'll look at the cholesterol medications. First is the HMG-CoA reductase inhibitors. These are known as statins. They reduce the production of cholesterol made by the liver, and these end with the suffix statin. There's atorvastatin, which is Lipitor, simvastatin, which is Zocor, rosuvastatin, which is Crestor, pravastatin, which is Pravachol, and lovastatin, which is Mevacor or Altoprev. And there are a couple other cholesterol medications in the top 200. First, we have ones that reduce cholesterol and triglyceride levels. This includes fenofibrate, which is Tracor, and the omega-3 acid ethyl esters, which is Lavaza. Then there's also one that inhibits the intestinal absorption of dietary cholesterol. This is ezetimibe, which is Zetia. Next, we have the diabetes medications. These include ones that are taken by mouth and also injectables. First is the sulfonylureas. These are taken by mouth, and they are the oldest diabetes medications available. The way they work is by increasing insulin release from the beta cells of the pancreas. There's glipizide, which is Glucotrol, and glimepiride, which is Amaryl. Next is the baguanides. These are also taken by mouth. They have a few mechanisms of action. They reduce the amount of sugar produced by the liver, reduce the amount of sugar absorbed in the intestines, and increase insulin sensitivity. And this includes metformin or glucophage. Next is the DPP-4 inhibitors. These are taken by mouth. They slow the inactivation and degradation of GLP-1, which is an incretin hormone that triggers insulin release to lower blood sugar. These end with the suffix gliptin. So there's linagliptin, which is Tradjenta, sitagliptin, which is Januvia, and then there's a combination product of metformin and sitagliptin, which is Janumet. Next is the TZDs. These are taken by mouth, and they're also known as the glitazones. They increase the sensitivity of cells to insulin, or in other words, decrease insulin resistance. These end with the suffix glitazone. And in the top 200, there's pioglitazone, which is Actos. Next is the SGLT2 inhibitors. These are taken by mouth, and they're known as the glyphosins. They cause more glucose to be excreted into the urine instead of reabsorbed into the body. And then the top 200, there's canagliflozin, which is Invokana. Next is the GLP-1 analogs. These are injectables, also known as incretin mimetics. These work by mimicking the incretin hormone GLP-1, which is produced in the GI tract after a meal, causing an increased release of insulin from the pancreas. And these end with the suffix glutide or atide. And in the top 200, we have liraglutide, which is Victoza, and dulaglutide, which is Trulicity. Next, we have the insulins. Now, these are all injectable. They take the place of insulin that's normally produced by the body in order to move glucose out of the blood into the body tissues where it's used for energy. There are different types of insulin. There's rapid, short, intermediate, and long-acting. And in the top 200, rapid and long-acting insulins are there. So we'll look first at the rapid-acting insulin. These have onset within 30 minutes and a duration of 3 to 5 hours. There's insulin Lispro, which is Humalog, and insulin Aspart, which is Novolog. Then there are the long-acting insulins. These onset within 2 hours, and they have a duration up to 24 hours. But with the Degludec insulin, it has a duration that can be up to 45 hours. So these in the top 200 include insulin Glargine, which is Lantus or Basaglar, and insulin Detamir, which is Levemir, and insulin Degludec, which is Tresiba. That concludes part 2, so thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. And up next, we'll be continuing our top 200 drug series with part 3, the GI medications. Thanks for watching. Hi, my name's Amanda. I'm a pharmacist. Today I'm continuing my top 200 drug series with part 3, GI medications. We'll be looking at what the drugs are for, their generic and brand names. First, we'll start with the stomach medications. These are for acid reflux and ulcers. First, there are the H2 antagonists, or H2 blockers as they're also known. These work by blocking the action of histamine at the histamine 2 receptors of the parietal cells of the stomach to reduce acid. They're used for the treatment and prevention of ulcers and GERD or acid reflux symptoms, including heartburn. These end with the suffix idine, I-D-I-N-E. First is ranitidine, which is Zantac. This one is actually off the market, but I included it in my presentation because it is still in the top 200 list that you'll see. And there's also famotidine, which is Pepcid. Next are the proton pump inhibitors, or PPIs. These work by blocking the final step in stomach acid production by irreversibly binding to the proton pump of the gastric parietal cells. These are used for the treatment and prevention of ulcers and GERD. They have more acid suppression than the H2 blockers. These end with the suffix prazole, and there's omeprazole, which is Prilosec, pantoprazole, which is Protonix, and esomeprazole, which is Nexium. Next are the antiemetic medications. These are for nausea and vomiting and motion sickness. First there are the antihistamine antiemetics, and these work by blocking the histamine H1 receptors in the brain that can cause nausea and vomiting and motion sickness. These include promethazine, which is Phenergan, and Meclizine, which is Antivert. Next are the 5-HT3 antagonists. These work by blocking serotonin receptors in the brain that can cause nausea and vomiting. And this includes ondansetron, which is Zofran. And next we'll look at a few other GI medications. First are medications for constipation. These work by increasing the amount of water the stool absorbs in the gut. And the laxative type may also be used as bowel prep prior to GI procedures. So first there's Docusate, which is Colace. This is a stool softener. And then there's polyethylene glycol, which is Miralax, and this is more of the laxative type. Next, there's a medication for irritable bowel and cramping. It's in the top 200. And these medications work by slowing the natural movements of the gut and by relaxing the muscles of the stomach and small intestines. And this includes dicyclamine, which is Bentyl. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be looking at continuing with our top 200 drug series with Part 4 seizure medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my top 200 drug series with Part 4 seizure medications. We'll be covering what the drugs are for, their generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So just an overview to start out of the seizure medications. They're also known as anti-epileptic drugs or anticonvulsants. They're used to treat seizure disorders, which is also known as epilepsy. Now, some of the seizure medications have other indications, including migraine headache prevention and bipolar disorder treatment. We'll look now at how the seizure medications work. In general, they work by changing the way brain cells, which are called neurons, send messages with substances called neurotransmitters and how the signals move in and out of the brain cells. This can happen by voltage-dependent sodium and calcium channels, SV2A protein, or the GABA inhibitory neurotransmitter. We aren't going to get into the mechanism of each individual seizure medication because some of the mechanisms of action are unknown and many of them aren't well understood. So that's just a general overview of how they work. So now we'll look at the seizure medications in the top 200 drugs. There's lamotrigine, brand name Lamictal, levetiracetam, brand name Keppra, oxcarbazepine, brand name Trileptal, divalproex sodium, brand name Depakote, and topiramate, brand name Topamax. And I've noted here that lamotrigine and divalproex sodium are also indicated for bipolar disorder, and divalproex sodium and topiramate are also indicated for migraine prevention. And there are two more seizure medications in the top 200 drugs. They're also used for nerve pain. This is gabapentin, brand name Neurontin, and then pregabalin. It is actually just used for nerve pain. Brand name is Lyrica. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be continuing with our top 200 drugs series with Part 5, pain medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'm continuing with my top 200 drug series with Part 5, the pain medications. We'll be looking at what the drugs are for, their generic and brand names. And if you find this information useful, please like this video and subscribe to my channel and share it with others who may benefit from this information as well. I really appreciate it. Thanks. So first we'll start with the medications for mild pain. In the top 200 we have Acetaminophen, which is Tylenol. It's also used to reduce fever, and surprisingly how it works is not completely understood. Next are medications for moderate to severe pain. This includes the opioid analgesics. The way these work is by binding to opioid receptors in the brain and spinal cord to reduce the sending of pain messages and the feeling of pain. This includes tramadol, the brand name is Ultram, hydrocodone with acetaminophen, brand name is Norco, oxycodone, which is roxicodone and Oxycontin, and morphine, which is Roxanol or MS-Contin. Next are the NSAIDs, which stands for the non-steroidal anti-inflammatory drugs. Now these are for pain and in larger doses also for inflammation. These work by reducing the production of prostaglandins by blocking the enzyme called cyclooxygenase, or COX for short. First there's ibuprofen. The brand name is Motrin or Advil. Next is naproxen. This is naproxen or Anaprox. Diclofenac, which is Voltaren. Ketorolac, which is Toradol. And meloxicam, which is Mobic. And now there are some NSAIDs that are more selective for COX-2 enzyme, which reduces the GI side effects that are commonly seen with NSAID use. And in the top 200 we have celecoxib, which is Celebrex. Next we'll look at the muscle relaxants. Now these aren't technically pain medications, but they're for muscle spasms. The exact mechanism of some of them is unknown, but generally they're thought to work by blocking nerve impulses from muscles to the brain and spinal cord. There's cyclobenzaprine, the brand name's Flexeril, tizanidine, the brand name is Xanaflex, methocarbamol, which is Robaxin, and baclofen, which is Leoracel. Next, we'll look at the 5-HT1B1D receptor antagonists. These are for migraine headaches. These work by binding to the serotonin 1B and 1D receptors on blood vessels in the brain to cause vasoconstriction. This includes the sumatriptan, which is Imitrex, and rizatriptan, which is Maxalt. Next we'll look at a combination medication that is in the top 200 for tension headache. This product is called acetaminophen, butalbital, and caffeine, and the brand name is Fioricet. This combination product, it helps headache pain with different mechanisms. The acetaminophen is for the pain. The caffeine is vasoconstrictive and enhances acetaminophen's pain relieving effect, and the butalbital promotes relaxation. And that's it for the pain medications in the top 200 drugs. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. And up next, we'll be continuing with our top 200 drug series with part 6, asthma and allergy medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'm continuing with my top 200 drug series with part 6, allergy and asthma medications. We'll be looking at what the drugs are for and how they work and their generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So first we'll begin with the antihistamines. These are the H1 receptor blockers. They work by blocking the effect of histamine 1, which is made by the body during an allergic reaction. The antihistamines, they're used to reduce allergy or allergic reaction symptoms, including itching, runny nose, and watery eyes. There's hydroxyzine, the brand name is Atarax or Vistaril. There's cetirizine, which is Zyrtec, and loratadine, which is Claritin. And I have noted here that the hydroxyzine also has anti-anxiety properties. Next are the corticosteroids, or sometimes they're just referred to as steroids. These are used to treat a wide range of inflammatory, allergic, and autoimmune conditions. And their use is not limited to asthma and allergies. They have many uses. The steroids work by decreasing inflammation and reducing the activity of the immune system. They resemble cortisol, which is a hormone made by the adrenal glands. There are many different dosage forms. There's intranasal, oral, topical, inhaled, and injectable formulations. And many of the steroids end with the suffix "-one", but not all. So first we'll look at intranasal steroids. These are in the form of a nasal spray. And they're for the symptoms of non-allergic and allergic rhinitis, or commonly called hay fever, which includes sneezing, runny nose, and itchy and watery eyes. And in the top 200, there's fluticasone, which is Flonase. Then there are topical steroids. This includes things like creams, ointments, lotions that are applied to the skin. These are for a wide variety of allergic reactions and inflammation of the skin, such as hives and rashes. Some examples include insect bites and stings, poison ivy, or a rash from an allergic reaction. And in the top 200, we have hydrocodone cream, which is cortisone, and triamcinolone cream, which is Aristocort or Kenalog. Then there are the oral steroids. These are tablets or liquid that's taken by mouth. They're for a wide variety of allergic reactions or inflammation of the body to decrease the immune response. Some examples include lung disease flare-ups, acute bronchitis, widespread rashes, or prevention of organ transplant rejection. So there are many, many uses for the oral steroids. In the top 200, there's prednisone, brand name is Deltazone, methylprednisolone, which is Medrol, and prednisolone, which is Prelone or Orapred. And then there are the inhaled steroids. This includes an inhaler or nebulizer versions. And these are for maintenance therapy for asthma and COPD and other chronic lung disease. In the top 200 is budesonide, which is Pulmicort. Then there are the leukotriene receptor antagonists. These work by blocking leukotrienes, which are released by the body when an allergen enters the airway, which causes swelling in the lungs and tightening of the muscles around the airway. The leukotriene receptor antagonists, they're used in the treatment of both allergies and asthma. And in the top 200, there's Montelukast, which is Singulair. Okay, next are the beta-2 agonist bronchodilators. These work by binding beta-2 receptors in the lungs, which promotes bronchial smooth muscle relaxation. They're used in the treatment of asthma and other lung disease to increase airflow to the lungs. And these come in inhaler and nebulizer formulations. And these generally end with the suffix terol. So in the top 200, there's albuterol, which is Proventil or Ventolin. Then there are the anticholinergic or antimuscarinic bronchodilators. These work by inhibiting muscarinic receptors, the M3 ones, in smooth muscle of the airway, which leads to bronchodilation. These are used to prevent bronchospasm in people with chronic bronchitis, emphysema, or COPD. There's a long-acting inhaler formulation in the top 200 drugs, which is tiotropium. The brand name is Spiriva. And you'll see other of these bronchodilators, and they generally end with the suffix pium, P-I-U-M. And next, there are the steroid and beta-2 bronchodilator combinations. These are for maintenance therapy used to control and prevent symptoms caused by asthma and COPD. They include a steroid plus a long-acting beta-2 agonist. So there's budesonide with formoterol, which is Symbicort, and fluticasone with salmeterol, which is Advair. Then another combination product, we have the antimuscarinic and beta-2 bronchodilator. This is used to treat and prevent wheezing and shortness of breath from chronic lung disease, including COPD, emphysema, and chronic bronchitis. And this combination product includes both types of bronchodilators, the antimuscarinic M3 one and the beta-2 bronchodilator. And in the top 200, the combination product we have is ipratropium and albuterol, and the brand names are Combivent and Duoneb. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. And up next, we'll be continuing with our Top 200 Drugs series with Part 7, Antibiotics, Antifungals, and Antivirals. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my Top 200 Drugs series with Part 7, Antibiotics, Antifungals, and Antivirals. We'll be looking at the indication, some pharmacology, and the generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So first we'll just look at some general information about antibiotics. Antibiotics are medications that specifically treat infections caused by bacteria, not viruses or other microorganisms, just bacteria. They work by killing bacteria, which is called bactericidal, or by inhibiting the growth of bacteria, which is called bacteriostatic. There are different types of antibiotics that treat different types of bacterial infections. First, we'll look at the penicillins. These are a type of beta-lactam antibiotic. Penicillins work by damaging the cell wall of the bacteria, so they're bactericidal, and they treat a wide range of infections. And penicillin was actually the first antibiotic used by doctors. And in the top 200, there's amoxicillin, brand name is Amoxil, and amoxicillin with clavulanic acid, and the brand name of that is Augmentin. And just a note here about the combination of amoxicillin with clavulanic acid. The clavulanic acid is not an antibiotic itself, but an inhibitor of the enzyme which breaks down the penicillin antibiotics. So by combining it with the amoxicillin, this allows the antibiotic to reach higher levels and to treat more types of infections. Next are the cephalosporins. These are also a beta-lactam antibiotic, and they work in the same way by damaging the cell wall of the bacteria, so they're bactericidal, and they treat a wide range of infections as well. Some examples of infections they treat include ear and sinus infections, urinary tract infections, infections of the GI tract. And in the top 200, there's cephalexin, which is Keflex, and cefdinir, which is Omnicef. Next are the fluoroquinolones, or they're sometimes just referred to as the quinolones. These work by inhibiting bacterial enzymes responsible for the DNA replication of the bacteria, and they are bactericidal. They treat a wide range of infections as well, including UTIs and respiratory infections. And the fluoroquinolones are generally strong antibiotics used for resistant infections. And in the top 200, there's ciprofloxacin, which is Cipro, and levofloxacin, which is Levaquin. Next are the sulfonamides. These are commonly known just as sulfa drugs. They work by inhibiting bacteria's ability to make folic acid, which is needed for their reproduction. They're bacteriostatic. The sulfonamides treat a wide range of infections, including UTIs, bronchitis, and prostate infections. And in the top 200, there's sulfamethoxazole combined with trimethoprim, when the brand name is Bactrim or Septra. And I have a note up here about the trimethoprim because it is not a sulfonamide. But trimethoprim, it's an antibiotic that also interferes with bacterial folic acid synthesis at a different step, causing greater effectiveness. So in combination, these two are actually bactericidal. Next are the macrolides. Sometimes they're called the erythromycin antibiotics. They work by inhibiting bacterial protein synthesis, which is needed for replication, and they do this in a reversible manner. So they're bacteriostatic. And the macrolides treat a wide range of infections, including UTIs, ear infections, upper and lower respiratory tract infections, stomach infections, skin infections, and STDs. And in the top 200, there's azithromycin, which is brand name is Zithromax. Next are the lincosamides, or the lincomycin antibiotics. These work by inhibiting bacterial protein synthesis, which is needed for replication, and they also do this in a reversible manner, like the macrolides. And they're also bacteriostatic. The leucosamides, they treat a wide range of anaerobic infections. Anaerobic means that the bacteria do not require oxygen for growth. And this includes dental, respiratory, skin, bone, and soft tissue infections. And in the top 200, there's clindamycin. The brand name is Cleocin. And just a note here that chemically, the leucosamides are unrelated to the macrolides, despite the same mycin suffix and mechanism of action. Next are the nitroimidazoles. These work by inhibiting bacterial nucleic acid synthesis, which disrupts the DNA. They are bactericidal. These treat a wide range of anaerobic infections, including infections of the GI tract, skin, urinary tract, bone, blood, central nervous system, heart, and lower respiratory tract. And also, this class of antibiotics has antiprotozoal activity against certain parasites and single-cell organisms like Trichomonas and amoeba. And in the top 200, there's metronidazole, brand name is Flagyl. Next are the nitrofurans. These work by several mechanisms. They disrupt the bacterial protein, cell wall, RNA, and DNA synthesis. And in the top 200, there's nitrofurantoin, brand name is Macrodantin and Macrobid. And this specific nitrofurantoin, it treats urinary tract infections. It's actually bactericidal in the urinary tract at therapeutic doses. And the way it works is it has a large crystal structure called a macrocrystal, which restricts absorption through the GI tract. So this allows for higher concentrations in the urine. Next are the tetracyclines. These work by disrupting bacterial protein synthesis, so they're bactericidal. They treat a wide range of infections, including infections of the intestine, respiratory tract, urinary tract, and eyes. And they're also used in the treatment of anthrax, various STDs, gum disease, and acne. And in the top 200 is doxycycline, which is vabromycin or Dorix. Next are the topical antibiotics. In the top 200, there's mupirocin, which is Bactroban. And this comes as a cream and an ointment. Mupirocin is a mixture of several pseudomonic acids which inhibit bacterial RNA and protein synthesis. It's bacteriostatic. And it treats a wide range of skin infections, typically due to staph or strep. That includes impetigo, open wounds, and MRSA. And it is inactive for most anaerobic bacteria. Next, we'll look at the antifungals. These are for the treatment of infections caused by a fungus, including yeast infections. There are different types of antifungals, but azoles are the only types in the top 200 drugs. And in the top 200, there's fluconazole, which is diflucan, and ketoconazole, which is Nizoral. And the azole antifungals work by interfering with fungal cell membrane synthesis, and they treat a wide range of fungal infections. And last are the antivirals. These are for the treatment of infections caused by a virus, and they are only effective while the virus is replicating. And there are different antivirals that work against different viruses. For herpes and varicella, which is chickenpox and shingles, in the top 200 there's acyclovir, brand name is Zovirax, and valcyclovir, brand name is Valtrex. And for influenza, there's oseltamivir, which is Tamiflu. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. And up next, we'll be continuing with our top 200 drug series with Part 8, Antidepressant and Antipsychotic Medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my top 200 drug series with Part 8, Antidepressants and Antipsychotics. We'll be looking at the indication, some mechanism of action and pharmacology of the drugs, and the generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. First, we'll start with the antidepressants. These are medications used primarily for the treatment of depression, but they may have other indications. They work by increasing certain neurotransmitter levels, which neurotransmitters are chemical messengers between nerve cells, and they do this to improve communication between nerve cells in order to strengthen the circuits which regulate mood. And there are different mechanisms for doing this and different neurotransmitters targeted, the main ones being serotonin, norepinephrine, and dopamine. First, we'll look at the tricyclic antidepressants, or TCAs. This is an older class of antidepressants. They work by blocking the reabsorption of serotonin and norepinephrine, and they also affect acetylcholine and histamine levels. This is what's responsible for certain side effects and why the tricyclic antidepressants may be used for conditions other than depression. And in the top 200, there's amitriptyline, the brand name is Elavil, and nortriptyline, the brand name is Pamelor. Next are the tetracyclic antidepressants. This is also an older class of antidepressants, similar in structure and action to the tricyclic antidepressants. Their exact mechanism is unknown, but what is known is that they increase serotonin and norepinephrine. And these, like the tricyclic antidepressants, the tetracyclic antidepressants affect other neurotransmitters, which leads to side effects. And in the top 200, there's mirtazapine, brand name is Remeron. Next are the serotonin antagonist and reuptake inhibitors. These work by blocking the binding of serotonin at certain undesired receptors. This is the serotonin antagonist part. And by blocking serotonin reabsorption. This is the reuptake inhibitor part. Their mechanism isn't completely understood though. This also is an older class of antidepressants with less selectivity, so once again it affects other neurotransmitters leading to side effects and possibly you see other uses because of that. And one of the other uses you often see the serotonin antagonist and reuptake inhibitors used for is the treatment of insomnia. However, this is an off-labeled use. And in the top 200 there's trazodone, the brand name is Deseril. Next are the selective serotonin reuptake inhibitors, the SSRIs. Now these work by selectively blocking the reabsorption of serotonin. So it's selective, so there are less side effects, and that makes them by far the most popular class. And they're also used for a variety of anxiety-related disorders too. In the top 200, there's sertraline, brand name Zoloft, fluoxetine, brand name Prozac, paroxetine, brand name is Paxil, citalopram, brand name Celexa, and S-citalopram, brand name is Lexapro. Next are the serotonin norepinephrine reuptake inhibitors, or SNRIs. These work by selectively blocking the reabsorption of serotonin and norepinephrine. So in addition to depression, these are also used for anxiety disorders, nerve pain, and fibromyalgia. And in the top 200, there's venlafaxine, brand name is Effexor, and duloxetine, brand name is Cymbalta. Then there are the norepinephrine dopamine reuptake inhibitors, or NDRIs. These work by selectively blocking the reabsorption of norepinephrine and dopamine. And in addition to depression, these are also used to help with smoking cessation. And this includes the drug bupropion, and the brand name is Wellbutrin, and the brand that's marketed for smoking cessation is Zyban. Next, we'll look at the antipsychotics. These are used to treat schizophrenia, severe depression, severe anxiety, and symptoms of psychosis such as delusions, hallucinations, and paranoia. The exact mechanism is unknown. Somehow they're known to work by blocking the dopamine and serotonin receptors. And there are two categories of antipsychotics. There's typical and atypical. The typical, are also known as first-generation antipsychotics. They're more likely to cause extrapyramidal symptoms, or EPS, which are drug-induced movement disorders affecting various parts of the body. Now, the atypical antipsychotics, or second generation, or SGAs as they're also known, they block dopamine receptors more selectively, which causes less EPS side effects than the first generation antipsychotics. However, they do cause more weight gain than the typical antipsychotics. And in the top 200 drugs, only atypical antipsychotics appear there. And there's risperidone, brand name Risperdal, quetiapine, brand name Seroquel, and aripiprazole, brand name Abilify. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be continuing with our Top 200 Drugs series with Part 9, Anxiolytics, Sedatives, and ADHD medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my Top 200 Drugs series with Part 9, Anxiolytics, Sedatives, and ADHD medications. We'll be covering what the drugs are for, some pharmacology and mechanism of action, and the generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. First, we'll look at the anxiolytics and sedatives. These are medications that work on the central nervous system to relieve anxiety, to have a calming effect, or help with sleep. And basically, anxiolytics are medications that reduce anxiety, and sedatives are medications that cause sleep. These are often grouped together because many drugs have both anxiolytic and sedative properties, and that's often dose dependent. And many of the antidepressants that we covered in the last presentation have anxiolytic effects as well. The first anxiolytic and sedative medications we'll look at are the benzodiazepines. These work by enhancing the inhibitory neurotransmitter called gamma-aminobutyric acid, or GABA, which has a calming effect on many brain functions. They're also used in the treatment of seizure disorders due to their GABA-enhancing effect. The benzodiazepines do have an addiction or dependence potential. They're a DEA Schedule IV. And their use as an anxiolytic or sleep aid depends on each benzodiazepine's pharmacokinetic profile, such as their onset of action, their duration, things like that. Okay, first we'll look at the benzodiazepines indicated for anxiety. And just as a general rule with the benzodiazepines, they end with the suffix -am. So there's alprazolam, brand name is Xanax, clonazepam, brand name is Klonopin, lorazepam, brand name is Ativan, and diazepam, brand name is Valium. And then in the top 200 of the benzodiazepines that are indicated for insomnia, we have temazepam, brand name is Restoril. Now we'll look at some of the other anxiolytics and sedatives in the top 200. First, there's zolpidem, brand name is Ambien. This is a non-benzodiazepine sleep aid that works by enhancing GABA, and it is also a DEA Schedule IV. And there's buspirone, brand name Buspar. This is an anxiolytic that binds at certain serotonin and dopamine receptors, but its exact mechanism for reducing anxiety is unknown. Now we'll look at the ADHD medications. And ADHD just stands for Attention Deficit Hyperactivity Disorder. And the goal with the medications is to decrease the symptoms of ADHD, so basically to improve focus and improve impulse control. And the ADHD medications work by increasing neurotransmitters that affect focus and impulse control, the two main ones being norepinephrine and dopamine. And there are both stimulant and non-stimulant type medications in this class. First, we'll look at the stimulants, or they're also called central nervous system stimulants. They're the most commonly prescribed medications for ADHD, but they do have abuse potential. They are a DEA Schedule II. And they work by increasing the amounts of dopamine and norepinephrine in the brain. And in the top 200, there's methylphenidate, brand name is Ritalin, dexmethylphenidate, brand name is Focalin, amphetamine with dextroamphetamine, brand name is Adderall, and lisdexamphetamine, brand name is Vyvanse. Now we'll look at the non-stimulants for ADHD in the top 200. First, there's atomoxetine, brand name is Strattera. This medication works by selectively inhibiting norepinephrine, causing increased levels, and it's not a controlled substance. And then there's an extended-release clonidine, brand name is Capvey, and an extended-release guanfacine, brand name is Intuniv. Now these we covered in the cardiovascular medications lecture, but I mention them here because they also are used for ADHD. They're alpha-2 agonist blood pressure medications, but it's the extended release formulations that are actually indicated for ADHD. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be continuing with our Top 200 Drugs series with Part 10, Gout, Glaucoma, Dementia, and Parkinson's disease medications. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my Top 200 Drugs presentation with Part 10, Gout, Glaucoma, Dementia, and Parkinson's disease medications. We'll be covering what the drugs are for, some pharmacology and mechanism of action, and the generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. First, we'll look at the gout medications. Gout is a condition of excess uric acid that leads to painful inflammation of the joints due to uric acid crystal deposits. So in the top 200, there's allopurinol, brand name is Zaloprim, and the way it works, it's a xanthine oxidase inhibitor. And it reduces the production of uric acid in the body, and it's used in the prevention of gout. And also in the top 200 for gout, there's colchicine, brand name is Colchris, and it is a tubulin disruptor. It blocks neutrophil-mediated inflammatory responses caused by uric acid, and it's used in both the prevention and treatment of gout. Next, we'll look at the medications for glaucoma, and these medications are all eye drops. Glaucoma is a condition of increased pressure of the eye, which can cause damage to the optic nerve. So the goal of the glaucoma eye drops is to lower the pressure in the eye in order to prevent blindness. And there are a few different classes of glaucoma eye drops. First, there's a beta blocker. It is Timolol, brand name is Timoptic. There's a prostaglandin analog. It is Latanoprost, brand name is Zalatan. And there's an alpha-2 agonist. It's Brimonidine, brand name is Alphagan P. Next are the medications for Parkinson's disease. Now, Parkinson's disease is a movement disorder resulting from decreased dopamine production in the brain's basal ganglia. The goal of the medications for Parkinson's disease is to reduce the symptoms of tremor, rigidity, and the things that are characteristic of that disease. And this is done by increasing dopamine in the brain. And there's a dopamine precursor and decarboxylase inhibitor combination in the top 200, and that is levodopa with carbidopa, brand name is Cinemet. And there are two dopamine agonists. There's pramipexole, brand name is Mirapex, and ropinirole, brand name is Requip. And also noted here that for the dopamine agonists, they are also used for restless leg syndrome. And next are the medications for dementia. Dementia is the loss of cognitive abilities, including remembering or thinking or making decisions that interfere with daily activities. And Alzheimer's disease is the main cause of dementia. So the target with the medications for dementia is to help improve mental function. And there are a couple different ones in the top 200. There's cholinesterase inhibitors. These work by increasing acetylcholine levels in the brain. And acetylcholine is a neurotransmitter that's important in the processes of memory, thinking, and reasoning. And that one is donepezil, and the brand name is Aricept. Then there is an NMDA receptor antagonist in the top 200. And the way these work is by decreasing glutamate, which in turn decreases calcium, and that slows damage to brain cells that is seen in Alzheimer's disease. And in the top 200 is memantine. The brand name is Namenda. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be continuing with our Top 200 Drugs series with Part 11 will be hormones and supplements. Thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my Top 200 Drugs series with Part 11, Hormones and Supplements. We'll be looking at the indication and the generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. First, we'll just give an overview about hormones. Hormones are the chemical messengers of the body produced by the endocrine glands. Small amounts of hormones can cause big changes in the body. This is why hormone imbalances can cause serious problems. There are laboratory tests that are used to check various hormone levels, and hormone drugs are used for correcting imbalances or for modifying various chemical responses or functions of the body. And there are several hormone types in the top 200 drugs. We'll just look at them briefly. First are estrogen hormones. There are many formulations of these, oral, topical, and transdermal. And then the top 200, there's estradiol, and some brand names are Estrace, Clamera, and Vivaldot. Then there are progesterone hormones, and in the top 200, there's progesterone, brand name is Prometrium, and norethindrone, brand name is Agestin or Orthomicronor. Then there are estrogen-progesterone combinations, and most of these are in tablet formulations. So there's ethinyl estradiol with norethindrone, and the brand name is Loestrin 120 or Ovcon 35. There's ethinyl estradiol with etonogestrel, and the brand name is NuvaRing. There's ethinyl estradiol with drospirenone, and the brand name is Yasmin or Yaz. Ethinyl estradiol with levonorgestrel. This is Elise or Seasonique. Ethinyl estradiol with norgestimate. This is orthocycline or orthotricycline. And ethinyl estradiol with desogestrel, and the brand name is Desogen or Mircet. Then there are also testosterone hormones. There are many formulations of these as well. Includes topical, transdermal, and injectable. And the generic is testosterone. Brand names are Androgel, Androderm, or Depot-testosterone. And now we'll look at the thyroid hormones. There's synthetic T4, which is thyroxine, and the generic for that is levothyroxine. The brand name is Synthroid or Levoxyl. There's synthetic T3, which is thyroid hormone, triiodothyronine. The generic name is liothyronine. Brand name is Cytomel. And there are also animal source thyroid hormones. The generic is just thyroid, and the brand name is Armour Thyroid. Now we'll look at the supplements in the top 200. These are basically vitamins and minerals that are needed for deficiencies. There are some supplements that do have other indications other than deficiencies as well, so that's good to know. And in the top 200, there's potassium chloride or KCl. The brand name is K-Dur or Chlorcon. There's ferrous sulfate or FeSO4, and the brand name is Feosol. There's magnesium oxide. The chemical formula is MgO. The brand name is Magox. There's ergocalciferol. That is vitamin D2. The brand name is Drisdol. And then there's calcium with cholecalciferol. That's calcium with vitamin D3. And the brand names are Caltrate or Oscal. And then there's folic acid. This is a synthetic vitamin B9, which is folate. And it's just, there's not really a brand on that one, it's just folic acid. And the same with the last one, cyanocobalamin, it's vitamin B12, and it's just vitamin B12, not really a brand name on that one. So thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we'll be continuing with our Top 200 Drugs series. This will be the last in our series. It will be part 12, just miscellaneous drugs. It's the ones that are remaining. So thanks for watching. Hi, my name's Amanda and I'm a pharmacist. Today I'll be continuing with my Top 200 Drugs series with our last presentation in the series, Part 12, Miscellaneous Drugs. We'll be looking at what the drugs are for, their generic and brand names. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So just to give you an idea of what we'll be covering in this presentation of miscellaneous drugs, I've tried to group the remaining medications in some sort of order. First we'll look at medications known as DMARDs, and then there are congestion and cough medications, and then finally it'll be the remaining medications on the top 200 drug list that really don't go with others. So first we'll look at the DMARDs. These are the disease-modifying anti-rheumatic drugs. Now DMARDs are not a group of chemically related drugs, but they are all drugs that are used in rheumatoid arthritis treatment to help preserve joints by blocking inflammation. First, there's hydroxychloroquine, brand name is Plaquenil. This is actually an anti-malarial drug used in the treatment and prevention of malaria, but it is also used to decrease pain and swelling in autoimmune diseases, including rheumatoid arthritis and lupus. Then there's adalimumab, brand name is Humira. This is a tumor necrosis factor, or TNF inhibitor, for inflammatory conditions of the body, including rheumatoid arthritis and psoriasis. And last in the DMARDs is methotrexate. Brand name is Trexall, and there are some others, but a lot of times this is just seen as methotrexate, not really written as a brand name. This works by inhibiting dihydrofolate reductase, which prevents folate from being converted to its active form. This interferes with the cell's DNA replication and repair, and it especially affects rapidly growing cells. This is why it's used in the treatment of certain cancers, and it's also used in the treatment of rheumatoid arthritis, but the mechanism, how it helps with the arthritis, is unknown. Next are a couple congestion and cough medications. First is guanfacine, brand name is Robitussin or Mucinex. This is an expectorant that thins mucus to help loosen chest and throat congestion. And then there's benzonatate, brand name is Tessalon Pearls. This is a cough suppressant that makes the cough reflex less active by numbing the throat and lungs. And then there are a few remaining medications on the top 200 drug list. First is alendronate, brand name is Fosamax. This is a bisphosphonate that slows bone loss. It's for the prevention and treatment of osteoporosis. Then there's finasteride, brand name is Proscar or Propecia. This is a 5-alpha reductase inhibitor that decreases the hormone DHT. It's used for enlarged prostate, or BPH, and that's what the Proscar brand is generally marketed for. And it's also used for hair loss, and that's what the Propecia brand is marketed for. Then there's phentermine, brand name is Adipex. This is a sympathomimetic amine that causes release of norepinephrine, which reduces the hunger sensation and suppresses the appetite. It's used for weight loss, and I noted here that it is a DEA Schedule 4, so it has some abuse and dependency potential. And then there's oxybutynin, brand name is Ditropan, that's the tablet form, or Oxytrol is a patch form. This is a urinary antispasmodic that blocks acetylcholine, which causes reduced bladder contractions, and it's used for overactive bladder. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you. And up next, we will begin a new series with our top 200 drug video flashcards with audio. And we will be reviewing the medications that we've done in this series. So we'll start with part 1, cardiovascular drugs. Thanks for watching.